Good morning. I am Professor Dilip Kumar Datta, written 40 books, working in the rural area of the Bengal, now staying in Kalani. Today, I will tell you how can you prevent the cervical, uterine, ovary and breast cancer as well as colon cancer. As you know, this is the cervix. So, this is cervical cancer, there is endometrial cancer, there is the ovarian cancer, there is tubal cancer, and this is the breast cancer. So, we can prevent the breast cancer. Let us start. We can prevent the breast cancer to identify ourselves, to see any secretion from the nipples, any tumor, anything, inform immediately doctors. We can take early care and the prevention. Secondly, we have to be very careful about the breast cancer because it is one of the very important causes of maternal death. So this is about the breast cancer. As regards the cervical cancer, which I highlighted to you, we can prevent the cervical cancer because the papillomavirus enter in the cervix and that leads to the problems. How can you diagnose the cervical cancer? We can do the pap smear, we can do the biopsy, we can do the colposcopy. So by this we can see whether she is suffering the cervical cancer, and that is very important because we are doing it in our clinic. We have done more than 3,000 colposcopy by my son Professor Indomil Datta. We find out very easy to diagnose the cervical cancer in the rural setup. Secondly, we come to the endometrial cancer, which of course requires some diagnosis early because we know the endometrial aspiration, endometrial biopsy, hysteroscopy or ultrasonography. We can diagnose this very easily. You have to see the thickening of the endometrium above 20 is very much 20 mm is very much important. And secondly, it is the polyp. So we can easy diagnosis. Regarding the ovarian cancer, we have to do the ultrasonography, MRI, and other things, and as well as blood and the tumor marker, and that can be done very easily. So hence we can tell very easily, in a nutshell, that we can prevent the breast cancer, cervical cancer, endometrial cancer, ovarian cancer, and the tubal cancer. But I am telling you one thing: if you diagnose very nicely the cervical cancer, there is no problem as early as possible. So, but in ovarian cancer, they always come in late. So any woman comes with any dyspepsia or any problems or swelling in the abdomen, immediately come to the doctors. So this is about the genital cancer, I am telling you, and breast cancer. Now I am telling very important subject, which is not concerned about. This is a stomach, this is a colon. Sometimes in women, we have the colonic cancer. The reason for the colonic cancer are many. Genetics is there, DNA abnormality is there. If there is endometrial cancer is that may be associated with endometrial cancer with the colonic cancer. But we miss this colonic cancer. So when you diagnose the thing about the genital cancer, we must exclude the colonic cancer, probably in the woman who has even some history of irregularity of the bowel or passing some blood. All these things are very important. So in a nutshell, I am telling before you, with children, please come and do the screening as early as possible, because staying in the rural area in the Bengal, I have seen that the rural women are suffering from very much, and you know that if we go to the outside, a lot of money is spending like this thing. Till today, government has got no 100% of this facility. So in conclusion, I say that as I am taking over the charge of the president of the IMA Bengal in January, I will go all through the rural Bengal to prevent the cervical and the genital cancer, breast cancer, and the colonic cancer as far as possible. So please bless me. Thank you very much. Thank you.